Hi and welcome. I'm trying to learn medicine. Today, acrocyanosis, and after we've done it, we're going to do median plane training. And if you participate in the median plane training, that is at your own risk. And we're talking about the blood system, internal anatomy, and the condition, the medical condition. And this is part 2. And this is no medical advice, we're just learning about it. Acrocyanosis, that is a harmless but persistent deficiency in the circulation of the extremities, hands, fingers, feet and toes of young women. Symptoms: there is no pain, but the fingers and hands are always cold and blue. Duration: a persistent complaint, but as the patient gets older, the symptoms abate. Okay, acrocyanosis, that is when people have cold and when people have persistently, the word is persistently? Yes, when people have persistently cold and blue hands because the blood supply is deficient, because there is deficient blood supply. And it lasts over, let's see the last thing, outlook good, but the condition will persist for several years. The condition lasts for several years, but over time it abates. I'm going to use the same word, I'm not completely sure what abate means. It abates. I think it releases, it gets down. Duration is causes. The blood vessels of the hands and feet are usually sensitive to cold. The reason for this is unknown. The blood vessels themselves, or the blood vessels, we have it in the first part of Acrocyanosis, where we didn't understand it. The blood vessels of the hands and feet are unusually sensitive to cold. Unsensitive. No, sensitive. Unusually sensitive. What does it mean? It means that the blood vessels are measuring that it is cold because they're too sensitive to cold, and then telling the body that the body should not bring so much blood to it so that they don't cool out. Which leads them to it that they actually cool out the hands and feet because they don't get enough blood supply. Is it then even working that the people are warmer because they don't bring so much blood to the hands and feet? That can be explained. And it is that the blood vessels of the hands and feet are unusually sensitive to cold. I maybe just going to say the way they said here because I think in the last part I understood it. But maybe I will understand it when I hear it again. The blood vessels of the hands and feet are unusually sensitive to cold. That means they are too sensitive, measuring the cold. And when they are stopping with the blood supply to not lose too much warmth through the dilated vessels. The reason for this is unknown, but it is a harmless condition. The reason is unknown, and is the only treatment if a condition persists and grows you. And it is advised to wear gloves. The treatment advised in this book is just and simple. The only treatment advised, the only available treatment advised is to keep the hands and feet warm. Okay, acrocyanosis. Acrocyanosis, that is that persistently the hands and feet are cold and blue because there is a deficiency in blood supply. The condition lasts over several years, but when it abates over years. The reason is that the blood vessels are too sensitive to cold, or unusually sensitive. The reason why that is not yet known in this book is in this book from the 1980s. And the only idea to minimize the harm to the only idea to live with the condition is to keep the hands in. The only. And this is my key project for medical advice. So I have a second camera, we're going to start now. And we want to see what happens. Acrocyanosis. That is when persistently the hands and feet. No, I can't say that. Acrocyanosis is a condition by which the feet and hand are persistently cold and blue. That is because the blood supply is deficiently to them. And the reason is that the blood vessels are unusually sensitive to cold. No, not to cold, it's just too sensitive. So, too cold. Acrocyanosis. That is a condition by which the blood supply to the hand and feet is persistently deficiently. And the reason is that the blood vessels are unusually sensitive to coldness. And we only treat... No. What do I wanted to mention there? Nothing, just with a warm. Everything consists of years. Okay. Acrocyanosis is a condition by which the blood supply to the hand and feet are persistently deficiently. And the hands and feet are cold and blue. And that condition lasts over years, but then over the years it abates slowly. And the only treatment in this book from the 80s advised is to keep the hands warm. And the reason for that whole condition is that the blood vessels are unusually sensitive to coldness. But why that is not known in this book. And that all is according to Keith Hodgins, Family Medical Advisor, page 62, but this is no medical advice. I'm going to stop the second camera. And we're going to go on with the next thing. The next thing will be medium plane training. Let's look if it works. If you were here for medicine, go to the next part of medicine. If you stay here and participate in the medium plane training, then it's really honest. We are bringing one leg up and we're putting the foot down. That is the mushroom. And we're going on with a greeting mushroom, foot up and down. And now we're waving mushroom more of a walrus as a morning stretch. And then the other direction. Makes sense. And now with the other foot. Leg up and point the foot down. Lowering the foot up and down. And now circles. And into the other direction. And now the first action exercise. One leg up into a right angle, flex foot, even and tips toward the back, and pressing the top against the knee. Have a little bend in here. And now let's try with the other leg. And pressing it forward. Right angle with the leg, flex foot, even and tips toward the back, little bend in here. And to the next exercise. Leg again up, and now we're pressing from the inside. And next exercise. Oh, with our leg. Again, the leg up. And we're pressing on the inside again. Continue with the exercise. And the other leg again. Leg again up. And now we're pressing with the knee up and to the side. And with the other leg again. Press up and to the side. Yes, okay, that was enough. And now to the next exercise, last exercise, where we swing your leg up and we press on the outside. And we're opening slowly. Close again. Open again. And close. And with the other leg. Leg up, press on the outside and open. Close. And the second one. And now the next exercise, just we're ending with a track lighter. Legs wide apart, we're going down, breathe in. And out. Okay. Out. And last round, breathe in. And out. We're going to cross the legs. And breathe out. Great, both for medium plane training. I thank you very much and until next time.